Labor, delivery, and postpartum. A patient is having trouble adjusting to breastfeeding and disagrees with her husband on the importance of breastfeeding compared to formula. Which member of the healthcare team should the nurse consult? Select the correct answer choice. A. Physician. B. Lactation consultant. C. Social worker. D. Charge nurse. The correct answer choice is B. Lactation consultant. Lactation consultants are professional breastfeeding specialists who can help with breastfeeding problems such as latching difficulties, poor milk supply, or trouble with pumping. They can provide education about the benefits of breastfeeding as well as troubleshooting problems during the adjustment period. A lactation consultant is trained to answer questions about breastfeeding and can best discuss these issues with the patient and her husband. The charge nurse, physician, and social worker do not have special breastfeeding training. A 30-year-old primipara is administered an epidural anesthesia. During the first hour of post-epidural anesthesia administration, which of the following signs and symptoms should be referred immediately to the anesthesiologist? Select the correct answer choice. A. Chills and cold, clammy skin. B. Urinary frequency. C. Respiratory distress. D. Nausea and vomiting. The correct answer choice is C. Respiratory distress. Epidural anesthesia can cause serious and potentially life-threatening complications. Safe and effective management requires a coordinated, multidisciplinary approach. Respiratory depression can result if opioids are used. Side effects of epidural opioids may include nausea and vomiting, pruritus, and delayed maternal depression. The possibility of late respiratory depression exists for up to 24 hours after the administration of an epidural, depending on the duration of action of the drug used. Epidural provides pain control during much of labor and for birth itself. Regional pain control methods can be used for intrapartum analgesia, surgical anesthesia, or both. These methods provide pain relief without loss of consciousness. The nurse is assessing a patient after delivery and finds the uterine fundus boggy and 1 centimeter above the umbilicus. Which of the following is the priority nursing intervention? Select the correct answer choice. A. Assess the perineal area. B. Notify the physician. C. Massage the uterus. D. Assess the vital signs. The correct answer choice is C. Massage the uterus. Using the ABC framework, the nurse skips airway and breathing and moves to an intervention to control bleeding in this situation. If there is uterine atony, the first priority intervention of the nurse is to control hemorrhage by attempting uterine massage to encourage contraction. This stimulates uterine contraction, which compresses the vessels and reduces blood flow. The second priority is to notify the physician if the uterus remains uncontracted. The physician will order oxytocics to help the uterus maintain tone. When the uterus is firm, observe the perineum for passage of clots and blood. Assess vital signs after ensuring that the uterus is well contracted. A patient with a history of hypertension in pregnancy calls the hospital complaining of a severe headache and blurred vision. How should the nurse respond? Select the correct answer choice. A. tell the patient to hang up and call 911 immediately. B. Tell the patient to take ibuprofen. C. Ask the patient how often she experiences these symptoms. D. Tell the patient to drive to the hospital for an evaluation. The correct answer choice is A. Tell the patient to hang up and call 911. Pregnancy-induced hypertension, or PIH, also called preeclampsia, must be monitored closely. Symptoms of worsening PIH include sudden weight gain, swelling or edema, severe headache, reports of seeing spots, blood in the urine, dizziness, or nausea and vomiting. When preeclampsia worsens during pregnancy, the baby may need to be delivered, or magnesium may need to be given intravenously to prevent seizures. The patient needs to call 911 to be evaluated and, if necessary, treated immediately to reduce her blood pressure and prevent complications. Pregnancy-induced hypertension can last for several weeks after delivery, and mothers may return home with by-mouth medications to control blood pressure. In planning postpartum nursing care for a patient with cardiac disease, the nurse would question which of the following physician orders. Select the correct answer choice. A. High-fiber diet. B. Monitor vital signs every 2 hours. C. Strict monitoring of input and output. D. High fluid intake. The correct answer choice is D. High fluid intake. The postpartum patient with cardiac disease is already at risk for fluid overload due to the extra accumulation of fluid from pregnancy. An excessive fluid intake in a patient with cardiac disease would increase the risk of heart failure. The nurse should question an order for high fluid intake for this patient. Monitoring input and output of the patient is the top priority of the nurse to prevent the risk of fluid overload. Vital signs should be monitored every 2 to 4 hours to monitor the cardiac condition of this patient. High-fiber diet is recommended to prevent constipation and straining. The nurse assesses a postpartum patient as having moderate Lochia Rubra with clots on her second postpartum day. Which of the following interventions would be appropriate? Select the correct answer choice. A. Assess the fundus and bladder status. B. Administer Methergin IM per physician's order. C. Notify the physician immediately. D. Catheterize the patient. The correct answer choice is A. Assess the fundus and bladder. Lochia Rubra is a postpartum vaginal discharge consisting almost entirely of blood. There are often small particles of deciduous and mucus during the first 3 postpartum days. This is expected. There is no complication or any signs of postpartum hemorrhage. During birth, the fetal head exerts pressure on the bladder and urethra as it passes the bladder's underside. This pressure may leave the bladder with a transient loss of tone. To prevent permanent damage to the bladder from overdistension, assess the woman's abdomen frequently. To assess involution process, the shrinking of the uterus after the birth, the nurse should palpate the fundus to see if it is firm and well contracted. Methergin should not be given because the woman is in her second postpartum day and has a normal lochia as expected. The other intervention choices are inappropriate because the woman is not suffering from blood loss. A patient is admitted to the hospital to deliver through labor induction. The nurse administers oxytocin as ordered by the physician. Knowing the potential complications of oxytocin, which of the following should the nurse monitor closely? Select the correct answer choice. A. Cervical dilation. B. Maternal heart rate. C. Fetal heart rate. D. Maternal neurological status. The correct answer choice is C. Fetal heart rate. Oxytocin stimulates strong uterine contractions that can cause decreased fetal heart rate and hypoxia due to increased uterine pressure. The nurse should closely monitor the fetal heart rate for any changes. Although it is important to monitor cervical dilation, maternal heart rate, and maternal neurological status, fetal heart rate is the most critical assessment to monitor when giving oxytocin. A woman who has been in labor for 6 hours is now 9 centimeters dilated and has intense contractions every 1 to 2 minutes. She is anxious and feels the need to bear down with her contractions. What is the best action for the nurse to take? Select the correct answer choice. A. Reposition her in a squatting position to make her more comfortable. B. Provide back rubs during contractions to distract her. C. Allow her to push so that the delivery can be expedited. D. Encourage panting through contractions to prevent pushing. The correct answer choice is D. Encourage the patient to pant through the contractions to prevent pushing. Because the woman has not reached full cervical dilation, which is 10 centimeters, it is best for the nurse to encourage the woman to breathe using repeated short puffs to delay pushing while allowing her cervix time to reach full dilation. Allowing the woman to push without a fully dilated cervix will predispose her to bleeding and cervical lacerations. By this time, the woman has already reached the transition phase of the first stage of labor. The contractions have reached their peak of intensity, occurring every 1 to 2 minutes. A woman in this phase may experience intense discomfort, so strong that she may also experience a feeling of loss of control, anxiety, panic, and irritability. During the first stage of labor, it is best to position the woman on the left side lying position. This position causes the heavy uterus to tip forward, away from the vena cava, allowing blood return from the lower extremities and adequate placental filling and circulation. During the transition phase, the woman often becomes irritable and restless. The patient may resist being touched and push away. The nurse is caring for a woman in labor. What signs or symptoms would indicate that the patient is in the transition stage of labor? Select all that apply. A. Increased irritability. B. Complaints of nausea. C. Has heavier show. D. Reports an uncontrollable urge to push or bear down. E. Bulging at the perineum. The correct answer choices are A. Increased irritability, B. Complaints of nausea, and C. Has heavier show. During the transition phase of the first stage of labor, the maximum cervical dilation of 8 to 10 centimeters occurs, and contractions reach their peak of intensity and occur every 2 to 3 minutes at a duration of 60 to 90 seconds. During the transition phase, the woman may experience intense discomfort so strong it is accompanied by nausea and vomiting. Because of the intensity and duration of the contractions, she may experience a feeling of loss of control, anxiety or panic, and irritability. Since dilation continues at a rapid rate, the membranes rupture and a heavy show is present. Uncontrollable urge to push or bear down and bulging at the perineum are signs of the second stage of labor. After performing Leopold's maneuvers on a patient in labor, the nurse should prepare the patient for a vaginal delivery after determining if the fetus is in which of the following positions. Select the correct answer choice. A. Transverse lie. B. Vertex presentation. C. Oblique lie. D. Face presentation. The correct answer choice is B. Vertex presentation. The vertex presentation is the most favorable presentation for normal vaginal birth. The fetus's head is the first part to contact the cervix, and the fetus's long axis is parallel with the long axis of the mother. Transverse lie, or the sideways position, poses a difficult presentation for vaginal birth. This would put both the mother and the child in jeopardy. It is advisable to have a cesarean section because the fetus is lying horizontally in the pelvis when this occurs. Oblique lie, or diagonal position, is a situation in which the long axis of the fetal body crosses that of the maternal body. If the fetal lie is not in line with the mother's spine, a cesarean section may be required. In face presentation, the fetus has extended its head to make the face the presenting part. The presenting diameter is so wide that the vaginal birth may be impossible. A patient in labor is being monitored for contractions. In order to document the patient's uterine activity before, during, and after each contraction, which of the following must the nurse document? Select all that apply. A. Contraction duration. B. Patient position. C. Contraction frequency. D. Cervical dilation. E. Contraction intensity. The correct answer choice is A. Contraction duration, and C. Contraction frequency, and E. Contraction intensity. The nurse needs to document uterine activity before, during, and after contractions. This includes the frequency, how often, intensity, how intense, or the firmness, duration, time from start to finish, and also uterine resting tone following contractions. Although contraction characteristics do not always correlate with labor progress, nurses are responsible for monitoring and describing uterine contractions in order to detect whether they have characteristics needed to expel the fetus and also to detect abnormal uterine activity. Monitoring contractions can be accomplished by palpation methods, maternal subjective reporting, external electronic monitoring, or internal monitoring, with varying degrees of accuracy depending on the method used. Dilation of the cervix should be documented at appropriate intervals, but is not always included when documenting uterine contractions. Patient position can affect the length of the labor, and this should be documented in the patient's chart, but this is not related to documenting uterine activity.